अच्छा, अब ये आइडेंटिफाई कैसे होगा कि कहाँ कहाँ शॉर्ट कमिंग्स है? ये एक कहते हैं ना कि बहुत एक्सटेंसिव क्वेश्चन था अगेन, बट देन ये किस तरीके से पता लगा, क्योंकि हम इंटरनेशनली, हम भी लोकल ग्रेजुएट्स हैं, उन्हीं कॉलेजेस से ग्रेजुएट करके आए हैं, निकल के आए हैं, देन वी डिड आवर मास्टर्स, डूइंग आवर पीएचडीज या फेलोशिप्स, सब कुछ कर रहे हैं। क्या इश्यूज हैं हमारे वहां पर कि हम इंटरनेशनली अपग्रेड नहीं हो पाते या इंटरनेशनल मार्केट को मीट नहीं कर पाते एट द एंड ऑफ द ट्रेनिंग, या अकेडमिकली अगर हम बहुत अच्छे हैं तो व्हाट वी लैक, पीछे क्या रह जाता है, क्या चीजें ऐसी हैं कि जिसकी वजह से समझ नहीं आता कि कितने होराइजन्स और मौजूद हैं। तो बहुत से इश्यूज हैं। पाकिस्तान, हम नो डाउट इट्स इज अ डेवलपिंग कंट्री, लॉजिस्टिक इश्यूज होते हैं, टेक्नोलॉजी इश्यूज होते हैं, एंड टू बी ऑन अ वेरी लाइटर नोट बट ऑन अ वेरी फेयर एस्पेक्ट, इसको कोई हार्श नहीं लेगा, नीयत का भी सवाल है। एट टाइम्स वी डोंट वांट टू स्टेप आउट ऑफ आवर कंफर्ट जोन। इसीलिए मैंने ये, आपने शायद एक छोटी सी एक पिक्चर देखी होगी, फिक्स माइंडसेट और ग्रोथ माइंडसेट को साथ रखा है कि फिक्स माइंडसेट से निकलना बहुत जरूरी है। जो हो रहा है, जो पैटर्न्स चलते आ रहे हैं, उसी को करना है, उसी के थ्रू चलना है। दिस इज नॉट यूजुअल, ठीक है, दिस इज नॉट एक्सेप्टेबल, दिस इज नॉट हाउ द ग्रोथ वर्क्स। सही है। हम अगर आज भी 3310 और पुरानी एफएक्स या मेहरा में गुजार सकते हैं जिंदगी, वेल एंड गुड, फेयर इनफ, फिर कोई सवाल नहीं। लेकिन अगर हम अपनी लग्जरी के लिए अपडेट मांगते हैं तो हमें अपने प्रोफेशनल ग्रूमिंग के लिए अपडेट 100% चाहिए। वो कैसे अपडेट होंगी, हम कैसे पे करें, हम कैसे, मतलब वर्कशॉप्स महंगी हैं, देयर इज नो एक्सक्यूज व्हेन यू वांट टू लर्न एंड व्हेन यू हैव एन एम्बिशन दैट इज क्वाइट क्लियर। उसके लिए क्या था, उसके लिए करियर काउंसलिंग थी, गाइडेंस थी, सब कुछ आके खत्म हो जाता है क्लिनिकल 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 क्लिनिकल। इट्स वेरी गुड, we should aim for clinic. We all of us are clinicians, but is it everything? No. Before reaching to the clinicals, there are hundreds and thousands of interdisciplinary, multidisciplinary approaches. इतने इतने रूट्स मौजूद हैं जिनको हमें एक्सप्लोर करना है। किस तरह एक्सप्लोर करेंगे, क्या क्या ऑप्शंस हैं, और बहुत से लोग जो हैं दे एम फॉर स्टडिंग एंड टू इमिग्रेट, उसके कौन से पाथवेज हैं, स्कॉलरशिप की क्या अपॉर्चुनिटीज हैं, इन सब के लिए अब वन मैन शो नहीं हो सकता। मोस्टली एक माइंडसेट होता है कि वी नो एवरीथिंग एंड वी कैन डू एवरीथिंग। what codem and what we practice, and we all of us, I think we do admit it, कि no one else can tell you better except the traveler himself. All of us can read the stories, we can never tell you how this happened, how we reached over there. So we tried to grasp and we tried to connect you to all those expert counselors, expert इमिग्रेशन कंसल्टेंट्स, स्टडी कंसल्टेंट, स्कॉलरशिप कंसल्टेंट्स, जो जिनके स्टैटिस्टिक्स मतलब सिर्फ वेबसाइट पे मौजूद नहीं है, हकीकत में हमारे अपने साथ मौजूद हैं, हमारे पास सक्सेस स्टोरीज उनकी मौजूद हैं।
एक्सक्यूज मी डॉक्टर, आई एम सॉरी, मैं आपको थोड़ा सा काट रहा हूँ। हमें काफी रिक्वेस्ट आ रही हैं कि इफ यू कैन काइंडली यू नो गिव योर लेक्चर, बिकॉज योर लेक्चर इज क्वाइट इंटरेस्टिंग फॉर क्वाइट अ few people in English.
Okay, sure,
Because there are few people who cannot understand Urdu, so there are quite requests coming. So sorry for the interruption.
No problem at all. So what exactly we were thinking is that what we can give back to Pakistan. So coming up, let me just come and focus on aims and objectives. How did we design CODEM? CODEM is designed for giving back in basically for 4 areas. What we found that where mentoring is required basically. So the first thing is upgradation of the local dental professionals and students in Pakistan. How do we upgrade them? Upgradation means that yes, there are brilliant graduates coming out from every university, rather it's government level or if it's a private sector, where they're trying to produce as much of as competent graduates, but where is the lacking? And who can check that where exactly is the lacking? We ourselves, because we all are, me, my husband, like Dr. Jamal, both of us are graduates of Pakistan, and we know what exactly have we gone through out our journey when we had to enroll either for our masters, our PhDs, our fellowships, wherever. So the trouble, the pain, the hurdles we faced out, we try to come up with the solutions and to give back and to prepare our graduates according to international standards, so that when they apply or when they think of the international boundaries, they would have the prerequisites filled up already. Okay, so this is one thing that we thought that this is what within Pakistan should be given. So how we designed workshops according to our standards, where what how the practices are being done overseas. Yes, the trainers are local, definitely, and they are very, very talented, they are very professional. What we do, we try to align through our expertise, and we try to come up with a course outline, and the delivery and mode of delivery should be according to what is taught internationally. Second comes career counseling and guidance. We found 99.9% of our youth, I'll consider everyone a youth, because when either if it is an undergraduate, graduate, or someone who's practicing but couldn't get any post graduation or any opportunity to immigrate abroad, any opportunity to find a scholarship, they never know that there are millions of horizons. I'm seriously, I'm not exaggerating. There are many ways. Life does not end on perio, prosto, operative, restorative, and ortho. I would definitely say that, like my co-colleagues, everyone would agree that yes, jumping to the clinicians, all of us are clinicians, and we all desire and dream to be clinicians, but this is not the end of the story. We all have to be practical. And for that, we have to focus on growth mindset rather than fixed mindset. That's why I've just posted this picture, so that we know that what exactly is the meaning of fixing there. Many of what we do is where we cannot do everything by ourselves, because yes, we can discuss and share and counsel and guide people according to our journey. But when it comes to career counseling, when it comes to immigration pathways, when it comes to scholarship opportunities, who is doing? Is it us doing it all alone? Master of all? No, it isn't this way. What we try is we try to connect you to the expertise, either it is in terms of immigrations. Okay, why to immigrate? If you want to study and immigrate, who is the consultant? Whom should you consult? Like, why should you believe us? What or how? What is the criteria that we are suggesting? The criteria is we can only judge them by their rate of successful statistics. Okay, someone who is claiming that he has this percentage of success rate, if he is offering someone an immigration pathway to Canada, immigration pathway to Poland, immigration pathways to Turkey, anywhere. So what is the statistics? That's how we determine their success rate. Then comes scholarship opportunities. Does the world ends on clinicians? No. What the people mostly come up is that their horizon is so narrow, or their aims are so fixed that they don't want to look right and left, and there is when they miss the opportunities. Okay, so what CODEM is bringing is it's giving you upgradation of the local dental professionals through workshops, long and short courses. It's giving you career counseling sessions continuously throughout the year, through webinars, through internal meetings. Then comes the many seminars. Then coming to the study and immigration programs, we are connecting you to the consultants who are experts in immigration policies, connecting you to scholarship opportunities. There is a very basic question which comes again and again regarding scholarship opportunities. Whoever asks, they are very firm about the clinical subjects. Please, there are very rare scholarship opportunities for the clinicians, but yes, there are. It's not that there isn't, but there are. But if you want to do something that could give you a promising career ahead, you should not stick yourself to certain specialities. Try to explore as much as you can. So for acquiring all of these, like study to immigrate or scholarship opportunities, or what exactly the career, what are the basic key points you should have in your mind? First of all, whenever we plan, we need to come out of our comfort zone and jump into the growth zone. You can find the zones. All of us know it very well that yes, when we aim something, we always have to know and calculate and have to aim ourselves that yes, we have to, there is a cost of everything. And all of us, we say it, but when it comes on practical applications, we forget it mostly. There are certain key points which I want to tell everyone, so that this is a small checklist. Trust me, if you're going to work on this checklist, nothing can stop you for acquiring your aims, your dreams. What is the first thing? The undergraduates, I would tell them, please work on your CGPA. You still have time. It has a big role whether you want to study and immigrate, whether you want to apply for scholarship opportunities, you want to apply for admissions in any postgraduate diplomas, courses, fellowships, programs. CGPA is the key factor, which is never emphasized that much when we were back in our days in the country. Second is the language proficiency. Start working on your language proficiencies, either it's IELTS exams. Don't get afraid. Try to practice as much as you can. And once you graduate, try to have your IELTS always ready in your hand when you are aiming to apply abroad. The third is an additional factor, GRE and SAT. This is called a supplement and a complement. Someone having a GRE and SAT gets, like, there are many things or many opportunities which are like, which where you can be prioritized if you have your GRE and SAT done. Then comes the research background. Most of us are very good in our academics. We are very excellent in our clinical hands, but when it comes to the research background, this is what exactly the whole world is looking for. We don't have a research background mostly. If we have a background, yes, we do have our name in one of the article as a third and fourth author. Okay, fine. How much understanding do you have as a researcher? You cannot ignore the fact of research in this era, not at all. Your publication. And then the most important thing, once you graduate, try to work on a nice research proposal. The stronger is your research proposal, the better are your opportunities. This is one way. Okay, research proposal is another big session. I cannot comment all on it, that how to design it, how to get it. It is another session, but yes, definitely this is one key factor, deciding factor where the candidate is being decided. Then comes the financial sketch. Always when you dream, dreaming is not like, I don't stop people from dreaming or aiming or having a developing a passion, but we all should draw our financial sketch, that what exactly we can afford, what is our limitation, and then try to maintain your bank statement starting from your undergraduate level. Trust me, this is possible. I have seen many people, many candidates who acquire the admissions, but their visas are being rejected. Why they are rejected? Because they cannot prove. This is very true. They cannot satisfy the visa officers regarding their bank statements. Yes, your parents are supporting, your mother is supporting, your father is supporting, but no, when it comes to professional education, most of the countries are there. They are very picky when they come to bank statements. The last thing, which is also an additional factor, is your travel history. If in life I think that we should add it as a luxury, if we can afford it, try to maintain your travel history. This would help you in a smooth transit to any destination. I hope I have covered what exactly I should have covered here, and coming that what exactly Codem is doing, and how what is our slogan is driven by quality and powered by solutions. Everything is possible. The possibilities are right in front of you. You only need to, maybe I'm a scientist, I'm a researcher, and I focus mostly on research, but trust me, research is not only sciences and in your books. Research is all is searching your opportunities and reaching them, and you all will enjoy it. We are always there to facilitate you. You can always reach all of us, and I would like to thank Dr. Kashif, Dr. Amna, Dr. Javed, and all of their team. This is one way we are giving back to our country, and we'll continue doing it. Thank you very much.
Thank you very much, Dr. Iram Khan. That's a very excellent and nice presentation. If I'll tell you, if you can stop sharing your screen, I think so you're still, sharing it.
Yeah.
Thank you very much. I must say that despite of the fact that I'm not a dental surgeon, I am other kind of, doctor dealing with the small babies whose main aim is just to cry while seeing me. And my main aim is to make them happy. Your presentation is just struck me like anything. And despite of the fact that I don't have any, knowledge about the dental registrations and everything, the way you have explained it, even a layman can understand it really well. So, Dr. Iram, thank you very much for that. And I
Thank
can
you.
see there are a few questions who are already, pouring in, but I will leave it till the end. I'll move to my next speaker, Dr. Javed. I have already given a brief introduction of Dr. Javed to the audience, but to tell the audience that I have, just had a brief discussion with him, and the way he has explained me the things is amazing. The things which he's doing for the students, for the dentist, and for the community to teach them, to motivate them is really admirable. And on my behalf, I'm really grateful to Javed, or Dr. Javed also, that he is given his valuable time to come and teach us. So, Dr. Javed, will you kindly introduce yourself to the attendees and just give your presentation? Thank you.
Perfect. Thank you very much, Dr. Kasher. Hi, everyone. So my name is Javed, and I am a graduate of Buckeye Medical University. So Dr. Aram was a year or 2 years junior than me, and her husband, Dr. Jamal. He was the professor during the time I was doing my undergraduate from Buckeye. So uh, yeah, so it's been after so many long years, I have seen Dr. Aram. Like I have seen her many times on many occasions during the presentation, but face to face or on the same panel. Like it's been years, like ever since we have seen each other. So I hope everything is well with you, Dr. Aram and Dr. Jamal. And so yeah, so basically my name is Javed, graduated from Buckeye Medical University in 2006. Again, I guess like with all the dental graduates, especially from Pakistan or from Southeast Asian countries, majority of us, we do dream to one day settle in a Western country and to practice either in UK, US, Canada, or Australia. So even when after I graduated, like that was one of the things where I was aiming uh, to settle in one of the Western countries. Um, I decided for US. So basically, I'm just going to talk about and talk over about my experience and how I perceive things during my journey of getting and being registered in US. So basically, the first step is like I'm going to talk about the US license process. So many of us. So Dr. Amna, can we go to the next slide, please? So I mean, there are two traditional ways. If you want to register yourself as a dentist in the US, the first is a very traditional way where you go and you do your advanced standing program, which is usually a 2-year program or a 3-year program. And I guess like it's very competitive because there are so many different kind of applicants who are applying. A huge number of applicants, they apply for these programs. So these programs, like when I moved there, I found like it's very competitive to get into these programs. The competition is really high. Unfortunately, I mean, from other part of the world during their undergraduate training, they do have some exposure for in research or other research related topics. But I mean, like I felt myself like this was one of the things which I was lacking when I was trying to compete with the other foreign trained dentists, international dentists for the same position. So I found like it was really hard to get into advanced standing programs. So that was the second option. Like I was thinking like, what is the other way to get registered in the US as a dentist? So I came across there are 9 specializations in the US, which are approved by the American Dental Association. So if out of those 9 specialization, majority of the specialization are clinical based specialization, which includes endodontics, prosthodontics, periodontics, pedodontics, orthodontics. So these all specialization, again, it's not just that the international dentists, they are competing to get the slots in these programs, but there are also the local dentists who have graduated from the US dental institutes. They also want to excel in their careers, and they want to apply for these programs. So clinical based programs, like, I came across, they are very competitive to get into, and yet and again it's very expensive, especially like if you're coming from the from Southeast Asian country or from a third world country. It's not very affordable. So I want to talk about the last 3 programs which I came across, which are very good, and they are basically a non-clinical specialization, but yet they have a very good standing in terms of a person who wants to establish themselves as a dentist in USA. So I'm going to talk about the last 3, which is oromaxillofacial pathology. This program is a non-clinical specialization approved by the ADA. So if as a foreign trained dentist, if you apply into this program, getting into this program, it's relatively very easy, because majority of the competition, it's towards the clinical specialization or to get into an advanced standing program. So majority of the times, these programs, they are so much under the radar that nobody, or majority of the application, don't even think about getting into these programs. So on an average, many of the times, like the slots or the seats for these programs, they are not filled. And the opportunity to get into these programs is really high. Same goes with the oromaxillofacial radiology. In my case, when I was looking for the option, I came across dental public health, based on the fact like that was the thing when I was applying for the advanced standing program. I came across that majority of the Western countries, they are basing their medicine on evidence-based. So research is a very important element of their education and for professional enhancement. So that was the reason, like, it attracted me. And again, it was relatively, the cost was really good for this program. Again, at the same time, getting into that program was relatively easy. So it was like a 2-year program. And like, once you do that program, you have an opportunity to register yourself, not just as a general dentist, but you are also treated as a specialist, as a dental public health specialist. So once you specialize from these programs, you cannot just add DDS in front of your name, but you can also add other specializations in addition to those credentials. One more good advantage of doing specialization, in my opinion, is that if for some reason somebody decides to move back to Pakistan or to their country, being a board certified specialist in US can have a very good future perspective in terms of a personal profession, in terms like if they are trying to move to Middle East or even trying to move back to Pakistan, so that board certification of these specializations are very helpful in order to gain a good position and a good placement for their future jobs. So again, I mean, in terms of settling in US, I came across there are 2 routes. The first is to get into a DDS or a DMD program. I guess it's a very good program, but again, it's very expensive and it's a very competitive to get into those programs. As compared to the specialization programs, there, as I mentioned, there are 9 specialization. Out of 9 specialization, these 3 specialization, oromaxillofacial radiology, pathology, and dental public health, are very cost effective in terms the pieces are not very high. It's very easy to get in. The admission criteria is not very hard. And again, you will still have that opportunity to register yourself as a dentist in US and work as a general dentist as well as a specialist dentist. When I was in US, I came across that unfortunately many of the Pakistani dentists coming to US, they were unaware of this route. And then me and my few other friends who were already doing this this program, we arranged, a small webinars and the seminars to spread the news to the Pakistani dental community that these are also the opportunities you just look into. Because once you move to another country, first of all, the struggle is a bit high in order to adjust in a new environment, adjust in a new country, adjusting in a new, atmosphere altogether. The language is the barrier. Definitely, as once we graduate, or the education system in Pakistan is definitely very good, but we are very good in reading and writing, but the speaking skills are not very enhanced for us. So all those factors are the things which we initially struggle with. And on the top, like if we have literally a very uphill battle to get into a dental school, it creates some more problems. So we thought, like, spreading the news about these 3 programs, which are non-clinical based, but again, very easy to get in, very cost effective. And again, you will have that specialist title in front of your name, can not just add a value, but also give you that professional satisfaction where you have not just the option to work in a clinic, but also as in academia or in a professional teaching institute. So that was my experience in the US. And since I came across these 3 specialization, non-clinical, whenever I guess like I meet someone from back home from Pakistan, and if they are struggling, I always recommend them to look into these routes and look into these specialization that can make their life easier and bit less challenging to get into, or challenging to get into the programs, and yet professionally develop yourself in those countries, right? So that was the part. So I lived in US for 14 years. I did my master's in public health, followed by dental public health. 2 years ago, because of my family, I have moved to UK now. So it's a temporary move, and I do plan to move back to US, like probably like in next couple of more years. So it's just a temporary move, but currently I'm based in UK now. So Dr. Amna, if we can come to another slide, the next slide. So when I moved to UK, definitely I was looking into the ORE route, but during that time I was preparing, all the COVID situation came about and everything. So I came across the dental care professional license. Many of the dentists who are in the UK, either they are working as a dental nurse or as office managers, and less of them, they are aware about these other dental care professional routes which they can use in order to register with the GDC and at least work more clinically, not as a dentist, but at least they will be working more on the clinical side as compared to working as a practice managers or as a dental nurses. So I found like majority of the applicants who are applying to the GDC for the DCP license, they go for dental therapist and dental hygiene license. In fact, like if you are registered as a dental therapist, you can work as a dental hygienist. So I came across, and I suggested many of my colleagues and many of my other friends that if you are applying for a dental care professional license, it's better to have a combination of a dental therapist and orthodontics therapist, which can increase your job perspective in UK, and the job market is going to be much more wider for you. Unfortunately, many of us, we have the perception that the application process is very rigorous, very hard, and we definitely need some help from so-called consultants who are sitting in UK and they are helping students to get through the process. I guess the application process it's really straightforward and simple. Yes, it's a bit time consuming, but many of the consultants, they are selling their products such as, we are going to provide you with the residential week, clinical hands-on training, which apparently don't have any standing. And in my opinion, that's basically a rip-off, and it's better to do your application on your own, right? So I guess like if you see, it's a very simple process, that on the first step, this is the email address for the GDC assessment team. If you request them, they send you the application. Once you have the application, it's the main part on that application is the learning outcome form. Once you have the learning outcome form, Dr. Amna, can we go to the next slide, please? So these are the documents which are needed, which is a syllabus from your dental institute, from the dental university or college where you graduated from. It just needs a letter on the top which states that, you know, this person is a bona fide student of this university and have graduated in this year. And the syllabus which is attached with this cover letter is the syllabus which was taught during the time he or she was a dental student in our institute, right? And that is the cover letter which you need with the syllabus. You also need a copy of your qualification, which needs to be certified. If you are in the UK, so it needs to be through solicitor, or if you're in Pakistan, you can easily get it notarized. On the application package, like there is a specific way how you want to get your documents certified. It's simply mentioned over there. This is how you want to get your documents certified: a copy of your passport, a passport size photograph, letter of good standing, professional work reference. I mean, and definitely, since we are applying for a dental care professional license, not as a dentist license, so the GDC is more interested in seeing your clinical aspects or your proficiency as being as a therapist or as a therapist or as a hygienist. So what you can do, you can search for the there's a document online on the GDC website which is scope of practice. So if you go on the scope of practice, there is a list of scope of practice for dental therapists and dental hygienists. So if you are making your professional work reference, make sure that you include all those points in your professional work reference. And then you need an evidence of English. So if you are graduated less than 2 years, you're exempt from English, or if you are based in an English-speaking country where you're professionally working, you can write an exempt letter, and then this is how you can get the exemption. And the third thing is doing the CPDs. For the CPDs, there are two very good sources. One is Isopharm and the other one is Dental Juice. So basically, yes, again, the application process is very lengthy. At the same time, it's very doable. The only thing which I advocate about is that don't use any consultants or any person who is going to help you to fill out the application. They usually charge anywhere between 1,500 to 1,900 or 2,000 pounds. It's not worth it. They don't even share the documents with you, that what documents they are submitting to GDC. So don't give your professional application to someone who's not even a dentist. When I was talking to Dr. Amna, I was like, I'm more than happy if the students or if the dental professionals from your, through you or through your organization want to come and, want to discuss their application in detail, I'm more than happy to help them. But just please make sure that whatever you are writing in your professional work reference or whatever CPDs you are doing, it should be in a way where, it's cover all your learning outcome form. So yeah, I mean, so the basic for my part for being in this webinar was to share my experience as a dentist in US and how the dental registration works over there. What are the routes? What are the different type of specialization? What are the different two ways you can get your registration? And the other thing is, when I came across the dental care professional license, I mean, please keep in mind that we are, as a dentist, we want to work as a dentist. So this is just in the time where you can register yourself, have more clinical experience, have a more clinical side of the dentistry in UK, and it is going to give you a financial stability where you can work towards to get your ORE exams done. I mean, definitely the pay scale is really good for the dental hygienist, dental therapist. So it just gives you that financial stability where you can think about, securing your future, completing your ORE. So that's about it, Dr. Kashif and Dr. Amna. I mean, probably like this is all the experience I have. And again, through your organization or through your forum, anyone who wants to get in touch with me, getting some help with their application, I don't charge anything. I don't do anything. I just, try to help as much as I can. And I'm just a big advocate that whatever you do in your professional life, in your professional experience, you should have a control over it. Unfortunately, many of the students or the dental professionals in UK, they are being victimized by so-called consultants, and they have no say, or they don't even know what's there in their application. So yeah, so that's about it from my side.
Thank you very much, Dr. Javed. That was another, smashing presentation, which is followed by Dr. Iram's presentation. And I'm really thinking that why I have joined, pediatric surgery, I should be a dentist, sitting with you, talking with you, getting your opinions and advice. And Dr. Javed, you have said a magic word at the end, that you don't charge anything. You are doing it for free. And I think so this thing, should be really appreciated by all the participants. And I must say, Dr. Iram, Dr. Jawad, or Dr. Amna, they're all doing it voluntarily. And they're all here to help you and guide you. And imagine this is such a day. They can spend their time with their families. They can spend their time watching the tally or doing some other work, but they are here sitting just to guide you, to help you. So thank you very much from my side. Now I will move on to Dr. Amna Azim. She's a very fresh graduate. She's a dental, surgeon, as well as she has joined the medical side of field also, doing the maxillofacial surgery and oral surgery. So Dr. Amna, if you can just introduce yourself, and if you can give your insight of this route of dental registrations in UK and Ireland, please.
Thank you, Dr. Kashif. Thanks for providing me this opportunity. And as you said, I am happy to help anybody who requires any kind of guidance, just to begin with. So this is not like a talk Dr. Iram and Dr. Javed has given. This is more like a journey that I'm going to be sharing, that how things have worked out for me and how perseverance and your commitment to your specialty makes a difference in your life. So what I'm going to suggest, obviously, don't get too much impressed by the first slide. So the issue is what we do and what we don't do while we're an undergraduate. This is very important because first of all, you have to make up your mind since your final year, what exactly you want to do. I know people just change their mind once they're doing their internships. They keep changing their preferences, that this is what they want to do. Like when I was in my internship, I thought when I was doing my prosthodontics, I want to be a prosthodontist. When I was doing my restorative, I wanted to be a restorative dentist. But then there comes a point when you actually set your mind on something, and then that's where your turning point is, that when you set your goal, you aim towards what you want to do, and then you persevere and you continue and you look towards your goal. There were many people who distracted me, who told me that, look, whatever you are thinking about, oral maxillofacial surgery is a man's specialty, to be honest. It's a male-dominating specialty. Women doesn't have any chance. So I think what helped me was, the more I heard that I cannot do it, the more I did it, because that was a key factor and that worked for me. So if anybody's telling you that you cannot do it or you shouldn't do it, please look into it and just decide for yourself what you want to do and what inspires you. So I graduated from Fatima Jinnah Dental College in Karachi. And then I moved to UK after my internship, and I did my Diploma Clinical Dental Sciences from Eastman Dental Institute. Following that, I was given the provision and opportunity to work and also to study a master's in oral maxillofacial surgery from Eastman again. And during that time, because obviously I was studying, so I thought that was an opportunity that I can utilize to do my MFDS and MJDF, which is what I did from Royal College of Surgeons of Edinburgh and England. And then I thought that, yes, this is what my calling is, because by that time I was pretty much sure that what I want to do. Basically, I decided when I was in my intern year that this is what I want to do. And I literally followed my pathway since then. After completing few of my years of training in the UK, in various units in London, Cambridgeshire, and Leeds, and a few other hospitals, I finally decided that this is the time that I should take this specialty seriously. And as you all know, that to do maxillofacial surgery, you have to be dual qualified, which was another task, which was like starting from the scratch. Once you've done your fellowship in maxillofacial already, and then you want to start from the scratch. That was a very difficult decision, because obviously it's not just the time, it's the financial implication as well. But believe it or not, once you make up your mind, Allah helps you. And from where you wouldn't even know. I mean, I know it's a very difficult task, and you think that, oh, there's too much of a financial aspect to it, but it's doable. If I say I have done it, I personally think anybody can do it. This is what I personally think. Then I moved to Ireland. I did my FFDA, and then Alhamdulillah, after a few years of training in the island, I was accepted for medical degree in one of the medical school in Dublin. I've recently graduated as a doctor as well. So that makes me a dentist and a doctor. So I'm a dental doctor. What I did as a work experience, I did my internship initially at Fatma Jinnah. I did my OMFS training in a few hospitals in the UK, and then I moved to Ireland and worked as a registrar, which has kindly helped me to progress further and to actually know the system. I'm going to talk a little bit about what exactly are the availabilities and what options do we have in Ireland. So Irish Dental Council, basically, they have one exam for you, which is equivalent to ORE or LDS. How does it work? So there are a couple of parts to it. Part A is more like a basic sciences. So I would suggest if anybody is thinking about moving to Ireland or UK, this is your time. If you're in your 4th year or in your house job, you should actually concentrate, look at the curriculum, what you need. And unfortunately, the problem is that you have to have a 2 year of experience before you actually sit these exams. So after you do your house job, you have to do 1 year of your training somewhere in any of the specialities, and only then you'll be able to apply, because I think they need 2 or 3 years of experience. But that is your time to build up and to decide what you want to do. There's another thing that attached to it is that if you do your exams, it doesn't automatically give you the right to work because of the citizenship issues or because of any kind of immigration issues. So this is something you have to be careful about. I think in the UK, this is more of a doable process, because in the UK, there are more wider opportunities for dentists. And currently, because of the Brexit, things have changed, and they do require a lot of dentists, and there are a lot of opportunities that has been opened since the European has exited the UK. But in Ireland, because obviously it's still in the EU, so there are very less opportunities. It's a very small country with 4 dental schools, very limited availability of jobs. Most of them are in maxillofacial surgery. Like there are 8 consultants or 9 consultants in the country and 4 units. So with the IDC, what you do is you can get your temporary registration, because Pakistani degree is considered equivalent, not equivalent, but is considered acceptable for temporary registration, which is for 5 years. So you can have 5 years temporary registration, work during that time on temporary registration, as long as you have a job offer. And then you can do your exams during that time, because you get into a system. It's very important to know the system. I am not aware of any of the hygienist or therapist route in Ireland, because I know I did explore at one point when I was doing my medicine, but that is not the option in Ireland. Whereas in the UK, obviously, like Dr. Javed said, that there are options of registering as a therapist and as your orthodontist therapist and all. So I think that's a better way than working as a practice manager or doing odd jobs. So the process is there are 2 exams. One is basic dental sciences, which covers your basic dentistry, like anatomy, physiology, and all. But then there's a key part to it, which is called a bench test, which has all the clinical practice exam, which is exactly equivalent to ORE Part 2, where you have to do mannequin test. Then comes once you pass that exam, you go to the next step, which is Part 2, and that is all the specialist dentistry exams. There are three exams basically, Viva and OSCE. So it's a 5-day exam. It's a very intense exam. You're exhausted by the time you finish your 1 week of exam. So how it works, the first paper is oral surgery, oral medicine, then you have prosthodontics, periodontics, and pedodontics. Then you have periodontics. They're all a couple of exams there. That's a written paper. That's what they're trying to assess, is that if you're as good as a final year dental student here in Ireland. So they judge you on that same level. So it's better if you can get a curriculum and see how things work for you, because believe it or not, dentistry is not different. It's exactly the same anywhere in any part of the world. It's just how you approach it. And then the last thing that you have to do for this exam is there's one day OSCE that there are some props there. You have to actually answer the questions, as we all know how the OSCE process works. And the final is the Viva. They actually check your treatment planning. They check how competent you are in your communication skills, how you can handle the most important thing is medical emergencies is a very, very, very key factor. And if you fail that, it's an automatic fail. So you have to make sure you know your emergencies. For these exams, you have to prepare really hard. If you're not prepared, I wouldn't suggest anybody to even try to, attempt at least once, because you have 3 attempts for these exams. And once these attempts are exhausted, that's it. You can't do it again. Whereas I think in ORE and LDS, they have 4 attempts. But again, they're limited attempts. So make sure it's a lengthy process, but it's not like it's not doable. So this is my journey. And I would like to especially thank my parents, my sibling, my family, my teachers from Patna, Dr. Prof. Isa Rai, Prof. Sakib Rashid, Prof. Taslim, Prof. Mervin, Dr. Asghar Mehdi, Dr. Shakir, Dr. Inayat, Dr. Arshad, and my institute, who has provided me this opportunity to be where I am, because without all of them, I wouldn't have been here where I am today. Thank you very much for listening.
Thank you very much, Dr. Amna. That was a very nice journey, which you have explained it really well. Just one thing I want to add my comment. The country which you are sitting in, Ireland, despite of the fact it is not as big as United Kingdom where I'm sitting at the moment, but I think so Ireland is a beautiful country with a very rich culture. And the other good thing which I found in Ireland, that the people are quite interlinked with each other. They are teaching opportunities, they are teaching sessions, just like the way you have done it to UCL, which is regarded as one of the best universities in the Europe. So yes, UK is a big country, but if any of the graduates, they got the chance to go to Ireland, I will take that opportunity with a head high up, and will start my training over there. The only example I can give you is mine. I started my training in Ireland, and due to that, training which I got in Ireland, I moved to UK to get the further higher surgical training. So it's a small country, but beautiful country. Now, I'll tell you, I've received quite a lot of questions. And I think so that I will start asking those questions to our respected panel. What I will say that if any of the attendee wants to ask any questions, they can write it down in our chat section, and I will pick it up and I will ask. I will start with Dr. Iram. Dr. Iram, I've got 2 main questions for you. The first question is, what is the best choice for post-graduation?
Best choice for post-graduation. This is what people mostly ask for. Let me just elaborate it very quickly. Most of us, we always focus on clinicals. So please, first of all, if you ask my choice, if you ask something that is doable, that has a promising future in terms of your profession, go for PhDs. Go for PhDs, choose an academic route. This will, and make up your mind to jump into transdisciplinary, interdisciplinary, and multidisciplinary subjects. Microbiology is your subject, biochemistry is your subject, physiology, anatomy, immunology. Nowadays, a huge work is being done on biofilm. Let me give you my example. During my master's, I did my master's in restorative dentistry, but during my master's, I came to know and I observed that the most developing area is biomaterial sciences. So I chose my thesis. The topic of my research was but something that's related to biomaterial sciences, what helped me to open up my horizons of professional growth, of you can say further developments and opportunities for PhDs. And when I started my PhD, I came to know again that now the things are not limited to biomaterials only. Rather than we have another era that's being working on biofilms. That's being, because whenever being a clinician, either we are a dentist or a medical doctor or something related to healthcare sciences, the biggest threat is infection. Where does the infection arise from? It arises from biofilms. So a huge research is going on biofilms. So what is related to biofilms? If you're working in microbiology, you're related to biofilms. You're working in biochemistry, you're helping the biofilms. If you have something coming up in bioengineering, that is also related to you. So please make up your mind and explore all possible options. Start and apply for a master's or an MPhil transit degree, and this make up your project during your master's level. You are going to prepare yourself that yes, I can drag my project to either in any of the specialties that is interrelated to dentistry. Academics is a huge, like let me tell you, most of us, we don't accept it, or if we know that we don't really have this practice in our countries, unfortunately, that we stick to the terms, the nomenclature. We are very, very conscious about the nomenclature. Please forget about it. Trust me, this is one big thing. So whenever you plan, if you plan to go for a short professional development, go for academics, go for masters reaching, and then take it to your PhD level. You're going to get many options as postdocs. You're going to get academic securities. No matter what, you will not restrict yourself to dental faculties only. You will have professional development in all healthcare academics and all healthcare faculties. So go for PhDs, please. Again, let me just complete it more further because it's coming up in my mind. Another question which stick us is that we always aim for UK, USA, Canada. That's all. That's where the limit ends. Okay. If we elaborate it a bit further, we just restrict to the Europe, or the maximum thing now when we are discussing is like, okay, we can explore Malaysia. There are many destinations in the world. Malaysia, Hong Kong, China, Cyprus, Turkey. Trust me, their work, their research, the projects that's being done as collaborative research, they prepare you so well that you're going to groom undimensionally. So whatsoever is your budget, whatsoever is don't limit yourself to the continents or to the countries. Just research and just explore whatsoever is possible.
Thank you very much, Dr. Ram. That's very nicely answered. I've got another question that you talked about scholarships in dental, post-graduation or dental pathway.
Yes. Yes.
I've got two people asking almost the same kind of question regarding that how they can be eligible, or how they can apply, or how they can make themselves more appropriate for those dental scholarships, and which is the way forward.
Okay. If you have seen the second last slide during my presentation, there was a slide of key points. Just consider all those points, okay? And you are going to be eligible for many scholarship options that's available in Cyprus these days. Trust me, Cyprus, Turkey, Malaysia, Hong Kong, these are myself. I have explored them myself. There are many options available there. Even if you talk about Canada, you need to have a very strong background. If someone is really looking forward for scholarship opportunities, they cannot ignore the fact of their research background. The stronger is the research background, the better is their possibility. The second thing is that we do have consultants. There is one doctor by the name of Dr. Imdad Rabi Bhatto. He's probably working in UK. Although he's an engineer, but he has his own not immigration. He has educational consultancy firm. How I came to know about him, it was through his success rate. I don't know whether people have spoke to him, but when I spoke to him and I discussed him, I said that because for the sake of mentoring people and for the sake of telling people to acquire the positions themselves, what would you suggest that how should they work? So from his expertise and from his experience and from my experience and research, I made up these key points and we came up that yes, these scholarship opportunities are available, but trust me, they're available in basic sciences. If you are looking for clinical degrees, I don't have any, until now, I haven't heard any specialty offering a full or 100% scholarship in clinical specialties. Dr. Javed would second me definitely. Okay, please, we need to come out of this dilemma. Trust me, this is a dilemma. I have seen many people stuck. They're very good in basic sciences, they're very good in biochemistries, they're very good in immunology, very good in microbiology, in pathology, but their mindset is so fixed for oral maxillofacial surgery, prosthodontics, orthodontics, ortho, that they are not ready to explore what exactly is available. So for scholarship opportunities, if you're looking for, you can always reach us. We are ready to guide you. We are ready to connect you to the people who genuinely have these possibilities in their hands, and they do connect you to the required to the specific supervisors and institutes. But yes, come up with two things. If you're ready to opt interdisciplinary subjects, come to us. And if you're ready to explore multiple destinations rather than focusing only in US, UK, Australia, and Canada.
Thank you very much, Dr. Iram. And there's another question regarding the same scholarship from Dr. Amna Shahid, who is one of the participants, is saying that, can you provide us with the link to apply for those scholarships?
Yeah, sure. I'm going to type in the comment section the WhatsApp number and the email address where you can connect us with your resume, and looking at your bio, we will connect you to the appropriate channels who can guide you well on your desired scholarship routes.
Thank you very much. I've got the next question from Dr. Zara Malik. And I think so any one of you can answer. The question is that comments and tips please on how to get into dental school in UK or European Union, and also which dental school in Europe to explore if wish to return to UK. So I will leave Dr. Amna or Dr. Javed to answer this question.
Okay, so in terms of dental schools in UK, I'm not very familiar about it because I haven't explored the options for the dental schools in UK. But if you're talking about the dental schools in Europe, Poland is a very good destination for the dental school. Bulgaria, Romania, those are the schools where there are a high number of international students that go there. And I have seen many students from who are British or the UK residents. They go to University of Plovdiv, which is in Bulgaria, Sofia, University of Sofia. But those programs are 5 years. So the first year is for the Romanian or the Bulgarian language school. And then the rest 4 years is the regular dental school, but they are taught in their own local language. So yeah, I mean, the option in Poland, Romania, and Bulgaria, they are very good, but I don't know about the recent, due to Brexit, I don't know if they are going to accept the dentists from the European Union, or are they going to treat them as if they are coming from any other part of the world and coming back and taking or sitting for the UR exams. So probably like after the Brexit, the things have changed. I'm not exactly familiar how it's going to plan out, but I'm assuming that probably they are going to treat the dentists from the European Union same as if they are coming from any other part of the world.
Thank you very much for that. I've got another question for you, Dr. Javed. You have talked about 2-year program. And this says that if anyone wants to do 2 programs, are they of any benefits? And if they are benefits, which two programs do you suggest?
So what in terms of 2 programs for the US, right?
Yes.
So, I mean, so basically, I mean, I don't know why would you want to do programs. I mean, if your main aim is to get a license, right? I guess like any of the programming, the US requirement is that if you want to practice in the US as a foreign trained dentist, you need to have at least 2 years of training school based in the US on the US soil, right? So regardless of whether it's a 2-year DDS or a DMD program, or whether it's a minimum of 2 years of dental specialist program, you are qualified for what do you call it, the license. Secondly, I don't see any reason if you want to do 1 specialization or 2 specialization or even 3 specialization, there is no cap on how many specialization you want to do. But I guess like it's totally someone's own personal preference. But you know, for the sake of the registration, 1 specialization is more than enough. But then again, it comes down to the preference where someone will have a dental I know someone who did dental public health as a first specialization, and then they went into a pediatric dentistry as a second specialization. But it's mainly upon their own personal wish and interest.
Thank you very much. I've got another question from Dr. Ayaz Malik, and he said that for dental therapist registration, can you please tell which CPDS to cover and how to comprehensively fill the learning outcome form? If any of the
See, so the learning outcome form, it's a very tricky question in terms like every school have their own syllabus. So it's very hard to pinpoint like how you're going to fill out the learning outcome form, right? Because what do you call it? Every school have their own different syllabus. So there are probably like more than 90 learning outcomes, or like somewhere between 80 to 90 learning outcomes, which you have to fill for the dental therapist license. So first of all, you have to make sure that the learning outcomes which you are reading on the GDC form, how you can relate to learning outcomes from your syllabus, right? So once you see that thing on your syllabus, you can mention that, okay, you know, for the journal anatomy, I have been taught, and it's evident in my syllabus that on page number 2 under journal anatomy, I have studied this topic. So that is going to fulfill your learning outcome. Followed by, I mean, and definitely if you think that is not very clear, you can always add that component to your work reference, where you can also tell them that, okay, you know, even though it is in my syllabus, but I have also covered that during my work experience. And the CPDs, I mean, they're listed when, I mean, usually you have to do list of like 70 to 80 CPDs. So it's very hard to pinpoint that which CPD is going to go in which learning outcome. So once you're doing your CPD, it will give you a picture. For example, there is a CPD on isopharm about consent. So in the learning outcome number, I guess it's 12.0 or 9.0, it's talking about the communication and consent. So you know that CPD, you can mention in your learning outcome for the learning outcome number 12 or number 9, that consent, even though, you know, it's not there in my syllabus, but it is there in my professional work experience, that during the time I was doing clinics, before treating any patients, I was taking a consent from the patient before starting the treatment. And on the safe side, I have also provided you with the learning outcome, I'm sorry, with the CPD from either from isopharm, from dental juice. There are so many sites where you can do your CPDs. So it's really hard to pinpoint, like, which CPD you're going to do for which learning outcome. So once you read about those CPDs, it will give you an idea that, okay, this CPD is going to go and, it's going to be for, learning outcome number so and so. So as I mentioned, the process of filling out the form, it's not very easy, not covered in your syllabus. How you're going to cover that in your professional CPDs. So I guess it takes a little bit of time. It's not very easy. So you have to really focus on your syllabus, your learning outcome based on your syllabus. Whatever is missing, then you can pick that up from your work experience, and anything to
Thank you very much, Dr. Javed. I think so there is some little bit of internet, problem. That's why, you were not hearing me properly. Anything else to add, Dr. Javed, which you have just answered? Anything else to add, or should I move on to the next question?
So yeah, no, as I mentioned, like it's the learning outcome form. It's not very simple. It takes some time. You have to focus on each learning outcome. Make sure you understand that learning outcome, and make sure that how you're going to show the GDC that that learning outcome has been covered in your syllabus. If not, how you have achieved or done it doing your CPD. So it's a series. I mean, like it's, as I mentioned, like it's not very easy, but like once you do first 5 or 10, then you have your syllabus in your mind, and then it just becomes a bit easy. So it takes 20 days. Rest is really easy. Rest is, there is no issue with anything else. The only main issue is the learning outcome form, right? So you have to really focus like what you're filling in, because GDC is trusting your judgment and your words of how you have done it, because GDC wants to see that how you have done it. So you are responsible to show GDC that they will make sure you study your syllabus really well. Try to identify all the points with your syllabus. What I can right now, so I'm flying back.
I think his net is not working.
Yeah, I think so. It says internet is not working. So I will move on to the next question. I think so that this was a very nice, session. So I will ask Dr. Amna. Dr. Amna, I've got a question for you. That you have done the dental and now you are doing the oral and maxillofacial, surgery. The question is that how long is the training pathway in this specialty? And are there any alternative routes to the SPR training?
Well, thank you very much. That's a very good question. It's a long journey, to be honest with you. If I divide it into years, it takes at least 15 years before you get to the consultant position, because you have to do your dentistry, which is 5 years in the UK, but 4 years in Pakistan. Just to let you know that 4-year degree is not like very much considered in the UK. So when you do your house job, you always have to tell them, if you're providing your assessment and all, that your internship was mandatory and it was part of your degree, which is what it makes to 5 years. 5 years of your your dental degree, then you have to do 2 years of your dental postgrad, which is your internship, and 1 year of experience. Then you can apply for medicine, which is another 4 years. Then there's a CT1, CT2, and then comes the training further for another 5 years. So it's a very long route. So you have to literally be committed to the specialty. And where it comes to the alternative pathway, yes, there are options, which is more like an assessment, and it's called a Caesar route. So people who hasn't followed, you can actually follow through your assessment process, and you can provide all your logbooks. This is something very important that I want to mention to you guys as well. From your day one, everybody should be maintaining their logbook, because that has helped me during all this process, because that is your, and the better is that whatever clinical work you do, you get it signed off by your senior colleague. So at least you know that you have an evidence that you are competent in so and so procedure. And then you can get a letter from your referee as well. So from final year, I would strongly suggest all dental students, regardless how you do it, you make a logbook, you get a scrapbook, you put a sticker anonymously, don't put the name of the patient, but make sure you record everything. And same as the Caesar route, as you go into higher training, where if you're in Pakistan or anywhere abroad, you're working in oral maxillofacial surgery, but make sure you maintain a logbook, which can prove that you are competent in certain procedures and you're able to do it. So that's a Caesar route application, but that's a long process as well.
Thank you very much, Dr. Amna. That's a very important question to be answered, because the people should know that what are the routes and how they can proceed. I'll tell you, I've got few more questions, but we are running short of time. So I will request the participants just to send us the question. Just go to our Facebook link and just inbox me the question, and I will forward it to the panels to be answered. And that brings us to the end of this very important, very educational session. I learned a lot knowing about the dental surgery and what are the parts and everything. I'm really grateful to Dr. Jawad for giving his precious time, Dr. Iram also for being there, and Dr. Amna also. So all three of you, thank you very much for being the part of this session. If anybody wants to
You're welcome.
look at this session again, it's all recorded. It will be on the Facebook as well as on NODFA, which is NODFA Facebook channel also. They can go and watch it over there also. So I'm just gonna stop the recording, first, and I'm gonna I've stopped the live streaming also. Can I request the panel just to stay in this session? And thank you very much for all the participants for your participation. And we'll see you again in our next session also.
Thank you very much.
Thank you.
Thank you.